and go.
So the paleo diet actually has been shown with clinical study, human clinical studies, that it is an anti-inflammatory diet, reduces symptoms of metabolic diseases like obesity, high LDLs and low HDLs and high blood pressure, things like that. So what the paleo diet is it a way of eating theoretically similar to our ancestors, our primal ancestors, that excluded the foods that were not there in those days of primal ancestors. So it doesn't include the grains that are inflammatory, it doesn't include added sugars, it does not include any processed seed oils, it does include meat that is pasture raised and fish that is wild caught, and organs and collagenous material and the fats that are in these animals. This is the paleo diet. Now, another diet that goes one step further, that is literally and theoretically and scientifically, clinically healthier, is a ketogenic diet, meaning or a low carbohydrate. Let's call it a low carbohydrate diet, where you're eating carbohydrates from foods like vegetables and fruits, but you're limiting it to maybe less than 100 to 150 grams per day. That would be considered a low carbohydrate diet. Now that's not as low as you can go, because the ketogenic diet goes one step further and it limits these carbohydrates to approximately 50 grams of carbohydrates per day. That's maybe maybe one sweet potato, something like that.
That's a little more than a half a sweet potato at that point.
Okay. So that's all that's the only carbohydrates you're going to eat. So it tends to help your body to become what's called fat adapted, meaning that you're not dependent on eating carbohydrates to produce glucose constantly. You're allowing your body to not have this excess carbohydrates, so that your body starts to metabolize the fat that is in your body, and it metabolizes it, and the liver kind of breaks it down and produces ketone bodies that actually function for energy better than glucose without the damage that glucose can bring when it's high. So that's a ketogenic diet, meaning a slightly healthier diet. So we went from Mediterranean to a Paleolithic to a low carbohydrate, and now to a ketogenic diet. All of the other foods from a paleo diet are part of the ketogenic diet and low carbs diet, with the exception of decreasing the amount of carbohydrate you're eating. Now, let's move to a slightly different type of diet that actually is reminiscent of our primal ancestors way back at least 160,000 years. And the reason I can say this is that there are anthropology tests and archaeological digs and studies of jaw remains that can show that our primal ancestors actually ate basically an animal-based diet, high animal-based diet, rather than foraging and eating nothing but plants. We can talk about that in a second because of our physiology too. But when you look at an animal-based diet and excluding all plants, here's something that's very interesting. Most, if not all, of the anti-nutrients that we eat from plants, like spinach, as I mentioned, the oxalates, the lectins, the phytates, and probably other things, are not in animal products. What happens is animals eat all these vegetables and fruits. They are that kind of an animal. They have the digestive system to literally destroy the actual anti-nutrients that are in the plants when they eat them. And the nutrients get absorbed into their meat, into their blood, and into their fat, and into their collagenous material. When you eat animals nose to tail, meaning that you're not just eating a piece of filet mignon, you're eating the liver, you're eating the cartilage, the fatty materials. You're getting all of these nutrients in a more biologically active fashion, and that has been proven. In addition, what is even more fascinating is that most people that do a little research and want to be on an animal-based diet, commonly called right now the carnivore diet, is that it doesn't have, for the most part, much fiber, if any, and it theoretically is devoid of vitamin C. Well, in fact, it is loaded with vitamin C because liver is loaded with vitamin C, and it's a different vitamin C than plant-based vitamin C. Liver-based vitamin C is heat stable, very biologically active. The vitamin C in plants is not that bioactive, and that's why practitioners force vitamin C through an IV tube because they need to overload the body with vitamin C. It will be better to get it from the liver, and that's another story we can talk about. But here's what happens with vitamin C. Vitamin C needs to get into the cell, but vitamin C competes with glucose. When you're eating a lot of carbs and there's too much glucose in the body, vitamin C has a hard time to get into the cell, which is critical. That's why you have to have more and more vitamin C to overload the excess glucose in the body. The other thing is that I mentioned is the fiber. It used to be thought that fiber was the only way for the bacteria in the gut to feed, to make its short-chain fatty acids and do what it's supposed to do. That's not true. There was an article published last year that was a very well in-depth paper that showed that the bacteria in the gut will ferment amino acids to produce every short-chain fatty acid that it produces from fiber. Fascinating. The body is so resilient. Another study was done a couple years ago that showed and these are human studies, they showed that a person on a strict plant-based diet had a certain type of microbiome, family of bacteria in the gut. But as soon as that diet changed to an animal-based diet, from plant-based to animal-based, and then from animal-based back to plant-based, the microbiome in the gut changed within 24 hours to accommodate the new foods. So the microbiome is a very resilient as well as adaptive type of community, but we still have to put in nutrients that are healthy for the body.
Yes. Tell me more about short-chain fatty acids.
So short-chain fatty acids are butyrate, propionate, and a variety of other chemical structures that the bacteria literally produce when they ferment amino acids and fiber, which is a non-soluble type of carbohydrate that your body is not using, but the bacteria does. And these short-chain fatty acids literally feed the layer of mucosal, mucous membrane, and also the mucous membrane fluids. So the mucus as well as the epithelial barrier are fed by these short-chain fatty acids. They also produce vitamins. It creates a variety of natural antibiotics that are produced by the bacteria. All of this is critical and healthy for the gut. And it's all natural. It's all produced by itself. Correct. We don't have to put anything in there other than healthy foods.
So with this gut dysbiosis, what are some of the conditions that can come about?
Well, unfortunately, almost every named chronic disease is a result of dysbiosis in the gut. So the pathway from the gut to the rest of the body, we would call a result of gut dysbiosis. And those would be cardiovascular disease, Alzheimer's disease, multiple sclerosis, diabetes, periodontal disease. All of these chronic diseases are the result of the continuum of the manifestation of the changes in the gut bacteria and the immune system and the inflammation as it results into the bloodstream.
Interesting. Now, with all of this going on, what have you recommended for oral hygiene? How would you approach this as a dentist, as a periodontist, to treat this gut dysbiosis?
It's a great question. So as a periodontist, I would be seeing patients that have active bleeding gums or something like that. And I just want to tell you that for the most part, the far majority of U.S. adult population has a form of gum disease. There was a study that was published in early 2000 that showed, and it was a study of college students that did show that around 92% of these people had some form of gum inflammation, some form of what's called gingivitis, some form of bleeding in some area in the mouth. That's not normal. You know, if you were, you know, a guy sitting or in the bathroom shaving, or a woman putting on her makeup, and they were looking at themselves very closely in a mirror, and all of a sudden you saw a drop of blood drip out of your ear, what would you think? I mean, that's terrible.
Yeah, something's wrong.
Yeah, if you scrubbed your nails with a nail brush and all of a sudden blood came out of your cuticle area, what would you think? There's something wrong. Yet you're brushing your teeth and you're flossing and you see a little pink. It's not a big deal. You go to the dental hygienist who cleans your teeth all the time, and how do they look? She said, it's not bad. It's just a little bleeding here. That's totally incorrect. There should never, ever, ever, ever be bleeding in the mouth unless you cut it. So normal brushing, normal flossing, normal cleaning in between the teeth with these little tiny brushes should never stimulate a bleeding response, no matter where. If you see bleeding, pink, or whatever anywhere in the mouth, you have active gum disease. Now, how bad is it? I don't know. But I'm telling you, you have active gum disease. And guess what? I think that's a huge biomarker that tells the dentist you have gut disease, gut dysbiosis also. And we need to look at both. Now, you can't say, I'm going to treat your gut and assume everything's going to be okay in the mouth. However, if you only have gum inflammation with no deep infection that's going into the bone structures called periodontitis, so it's just gingivitis, actual double-blind human studies have been done over the last 5 to 10 years that show if you change the diet and remove these inflammatory foods that I just explained, you don't have to do anything to your mouth. The infection goes away by itself. And actually, these tests have been done with people not brushing or flossing for 30 days. They have gobs of plaque in their mouth. But the experimental group, which is on a healthier diet, even though they have lots of bacteria, they're in a state of balance, and the inflammation, the bleeding, and the other signs of infection go away. And then the control group that is not eating a healthy diet, that didn't brush and floss, they have gobs and gobs of plaque. But all of this is unhealthy with very high percentages of the pathogenic bacteria, and therefore more bleeding and other signs of gum disease. So diet is critical. But once the infection starts to get under the gum, you have to do more therapy. So what I tell patients is, I'm going to show you how to clean your mouth thoroughly. Not only brush correctly, and flossing is not that important. Flossing is good to get stuff between the teeth, the contacts out, but little brushes that go between the teeth at the gum line where the gum meets the tooth, they're very tiny brushes, almost looks like baby brushes to clean out baby bottles, but these are literally tiny, and they're made up of silicone, and that actually rubs the surface where the gum meets the tooth, and it removes the excess heavy, unhealthy bacteria called dental plaque, but other healthy plaque underneath of it can still remain. And if there's infection in any way, using those little tips will actually stimulate a little bleeding. And any bleeding, any pink says you have infection. So you need to brush correctly, you need to clean between the teeth correctly, and also you want to brush your tongue. You're not trying to sterilize your tongue. You want to remove the excess unhealthy accumulation of bacteria and decaying food particles. And to do that, you can use a tongue scraper, but you can use simply a spoon. Invert the spoon, put it back in your mouth, touch the spoon inverted to the back of your tongue just before you want to gag, and then pull the spoon forward as you scrape your tongue, and you'll see this little milky fluid that is accumulating in the base of the spoon. That is the excess bacteria and food particles. Do it 2 or 3 times a day, once a day or twice a day before you go to sleep, and you'll remove that unhealthy bacteria. That's what I recommend patients to do that they can have control over. And then I recommend getting started with a healthier diet and then rebuilding the healthy gut microbiome. And I use specific spore-based probiotics because they're the only probiotics that work 100%. Other probiotics like lactobacilli and bifidobacteria make lots of metabolites. They create lots of chemicals that get into your gut, but all these bacteria get killed immediately in the stomach acid, so they don't regenerate. Spore-based bacillus bacteria do regenerate in the gut, and they do everything else.
Interesting, interesting, interesting. Now, what I want to do is I want to switch gears, and I want to talk about you now. Here we go. I want to talk about you, and I want to relate what you went through to what we've discussed with this gut dysbiosis. Now, Dr. Al was diagnosed with multiple myeloma, and he's here today, and he's imparting significant information to all of us. I'm learning right now so much. So let's talk about your unconventional cancer journey, as you call it, because when you first told me what had happened, I was floored. I was floored, and how you went from that to where you are today.
Sure. So I started developing, I was basically a healthy guy. I thought at the age of 71, I was on paleo, I was exercising, I was lecturing all around the country, writing about and incorporating these concepts with my patient treatment. And I thought I was the poster boy of senior poster boy for a healthy lifestyle. So I'm actually traveling to Austin, Texas from Charleston, South Carolina. I'm speaking at the Paleo FX meeting, and I carry my bags on my shoulder when I'm in the airport, and it started to get sore on my right shoulder, and it didn't go away. And I went to the meeting, I did my meeting, and came back to Charleston. The soreness actually started to dissipate from my shoulder, went to my back, then it dissipated from my back, went to my chest, and I'm kind of a hard head, so it took me until August of 2018 to finally see my physician and see what was going on. He said, let's do some blood tests. So all the blood tests were normal except one, which was a HS, high sensitivity CRP, C-reactive protein. Kind of tells you if there's inflammation in your body. Doesn't tell you where, doesn't tell you how long you've had it, doesn't tell how severe it is, just says, yeah, you got inflammation. Well, mine normally runs very normal, less than 0.5. This was somewhere in the 5 range, 5.0 range, and he said, okay, let's do an MRI. So we do an MRI. This is September of 2018, and the MRI comes back, and my physician calls me, and he discusses on the phone what he thinks is going on, and he says, I think you have either lymphoma, leukemia, or multiple myeloma. Wow, blows you away, right? I'm such a healthy guy. He sees a vertebral compression fracture. He sees 2 or 3 ribs that are already cracked. He sees a hairline crack in my pelvis. He jokes around and says, did you fall down some steps or get into a fight? Obviously, I didn't. And he says, we need to call in an oncologist and do some more tests. One of the tests was a PET scan, which is a very sophisticated test with an X-ray type of 3-dimensional X-ray of the entire body, but it also includes an injection of a radio active glucose into your bloodstream, because if you have cancer, the cancer cells just eat up glucose, and when they eat up the radioactive glucose, it kind of shines on the X-ray and it shows very lighted areas where the cancer cells are. So they did that, and I also had a mass around the side of my spine, a soft tissue mass that they biopsied, which turned out to be malignant plasma cells. So I go into my oncologist, he tells me and my wife, my adult kids, what's going on. So I have a diagnosis, this is September of 2019, as I said, of IgA kappa light chain multiple myeloma, which is kind of an aggressive form of multiple myeloma. And in addition, I have what the radiologist called innumerable lytic lesions throughout my spine. So lytic lesions throughout my spine mean lots and lots of holes, like a patient with severe osteoporosis. My skeleton is very fragile. That's why I had shoulder pain. That's why I had a compression fracture of a vertebra and ribs that are cracked and pelvis is cracked. So he says, let's go ahead and do chemotherapy. We're going to start right away. I said, what's going on with this? What's going to happen? He said, well, this disease is incurable. You know what the word incurable means. I'm going to die from it.
Mm-hmm.
So he says, we need to do this chemotherapy. We have to kill all these cells, and literally it'll destroy your immune system, but we need to get you in remission so that we can help rebuild you. But you will go in and out of remission, and each time we'll go into a different chemotherapy cocktail, more caustic as we go along, until it doesn't work anymore. Stem cells would not really work for me, and then eventually I would die from multiple myeloma, the complications of multiple myeloma. So I'm telling him, in all honesty, I'm really trying to be logical here. If the disease is not curable and the chemotherapy is going to destroy my immune system and literally affect the quality of my life, I have no interest in longevity. I only have interest in the remaining quality years in my life. And I said, I'm not going to do chemo. And I didn't. And he was on the same page that I was, because he knew this was not curable. And I did a bunch of research to figure out what I could do to assist my body's healing to maybe get a better result. And I did this research to create what I call my Unconventional Cancer Protocols. And I started it immediately. Now, I've tweaked it many, many times along the way, but basically what I am doing now is an animal-based diet, the carnivore diet, to protect my gut and put the nutrients that I need to put in my gut and feed my microbiome. And it's interesting, there is a clinic in Budapest, Hungary, called Paleomedicina Clinic, and they have treated over 4,000 patients a year or two ago. So it may be more patients with severe chronic diseases, including cancer, and they have documented, reported case studies or case reports of these individual cure rates. Now, they can't say that in the United States, but in Hungary you can say different things. And basically they show that this very strict animal-based diet, and they call it the Paleolithic ketogenic diet, which is a strict carnivore diet, has changed the metabolism, has healed the gut, and has healed what's called metabolic endotoxemia, when all this infection gets into the bloodstream, has healed all of that. And because of that, it has allowed the immune system to heal from these chronic diseases, including cancer. So that's why I'm on the carnivore diet as of now. In addition, I do quite a bit to strengthen my gut. And I use spore-based probiotics. I use 2 different companies. One, they have many other products that I use called Microbiome Labs. It's a phenomenal company with phenomenal products. And there's another company called Enviromedica that I use their spore-based probiotics, a little different blend of spore-based probiotics, but they also include a type of metabolite that enhances the immune system in their concoction, which is very good. And then I use some other products to support my mucus layer and my epithelial barrier and feed these friendly bacteria, and I do that with products from Microbiome Labs. They have a variety of products, and I do have a strict protocol that I follow, and I can send that to anybody that wants it. It's not only my cancer protocol, but it's the way I eat, and it's the way I support my microbiome. In addition, if you still want me to go on, I have
keep going. No, keep going. I am all in. I am fascinated right now. Keep going, please.
So the diet and the microbiome, making it healthy, absolutely, definitely supports and enhances the immune system, which is critical. And we can go into a lengthy interview just of the immune system, but it's supporting the immune system. But I do a few other things that are herbal for my immune system. I take 4 basically herbal products. I hope I remember it. It's astragalus, echinacea, ashwagandha, and Korean ginseng. So I do that only because my research has showed me that some have been done where these particular herbal products do support a variety of functions in the immune system. And so I take it in an extract form, which is a pure form, rather than capsules, because I have found that most supplements and capsules or tablets have so many additives that are not healthy for the gut microbiome. And when you're taking supplements and you have one that has some bad stuff in it, but now you're taking 5 that have each has some bad stuff in it, you get this extra load of unhealthy additives that are not good for the gut. So I want the pure. So these are alcohol extracted herbs. In addition, which I also think is very important, and let me just mention, cancer is a disease of metabolic dysfunction and mitochondrial dysfunction. It is not a disease of genetic dysfunction and dystoria. So it's just not, you have bad genetics, you're going to get cancer, and that's the way it goes. Cut it out because it's going to become cancerous. That's not true. As a matter of fact, even though if you have a genetic predisposition for a malignancy and other things, but a malignancy, if you control the epigenetics, the lifestyle, and the diet, that's what epigenetics is. If you control the substances that your body, those affect either the production of the manifestation of that gene, or it subdues that gene. And if you have a healthy anti-inflammatory diet and you have a healthy gut microbiome, you can suppress bad genes and you won't get the disease and you won't get cancer. But if you have poor diet, which would be called metabolic dysfunction, it can contribute to cancer. And more specifically, the organelles in every cell in our body except red blood cells create power or energy for that cell to function. And those are called mitochondria. So mitochondria are like batteries. If you had a flashlight and you wanted to make it work, you have to have batteries, and you put the switch on, and you see this light glowing. And that's what the battery will do for the flashlight. If you keep the light on, you'll notice that the light dims. And the only reason it dims is the flashlight battery is weakening. And eventually the light goes out because the batteries are dead. So those batteries are akin to the mitochondria in every cell, except the red blood cells. Some cells have 100 or 200 mitochondria per cell. Some, like the heart tissue, has 2,000 or 3,000 mitochondria per cell. But this is what creates the energy to make that cell do what it's supposed to do. When there is cancer, that mitochondria in cells becomes non-functional, and the cell starts to change, and it can become malignant, and it doesn't produce energy properly. And that's why some of them just ferment glucose, but they don't use the proper mechanism of the cell to create energy. And so we need to treat the mitochondria of the cells, at least I think I need to. One way to do that, which is fascinating, is another modality called pulsed electromagnetic field therapy. Now this pulsed electromagnetic field therapy, called PEMF therapy, is documented in many medical research journals, that it shows how it heals bone and soft tissue. And pulsed electromagnetic field therapy, if you're using the right frequencies with the right design mat, creates a harmonic balance of frequencies that are similar to the human frequencies that cells talk to one another with. And these frequencies literally help the cell membrane to become more energized, and actually repairs the elements inside the mitochondria that are dysfunctional. So I use a pulsed electromagnetic field full body mat that sits in my bed, and I just lay on it. It's like a soft yoga mat. And I dial in a certain frequency because I have a protocol, and I use it 3 or 4 times a day. And there are a variety of mats. Some of them do not produce the healthier frequencies, some do. And I use a mat from a company called Pure Wave that imports the mat out of Germany. And this therapy, along with everything else I just mentioned, is like a shotgun approach. I do so many different things to improve my diet, my gut, my immune system, my cellular function. I think all of these have gone a long way to make me healthy. Now, my oncologist also found 2 therapies that were just approved by the FDA that actually are not, it's not chemotherapy, it is a human-derived monoclonal antibody that actually can get injected into my body to kill specifically my malignant cells, which are malignant plasma cells, and I've incorporated that in my protocol so over the last several months. So all of that has been happening. So in May of 2018, mind you, I'm supposed to be dead, right? My oncologist gave me 3 to 6 months to live. Everybody thought I was going to be dead by September 2018. By September of 2019, I was doing well. But here's what happened in September 2019. I'm in my bathroom brushing and flossing my teeth, and I don't realize how fragile my bones are, although I've had a number of pathological fractures. I twist to throw some dental floss into the trash can. So my feet are planted on the floor. I twist about 90 degrees to the left. And when I twist, my right femur splits in half and I crash to the floor. It literally split in half. Crashed to the floor, broke a couple more ribs, and broke my right humerus in half. I am literally writhing with pain on the floor. I've outlived the prognosis that I thought I was given, and I thought I was going to die, and I really wanted to die at that point. I was in so much pain, whatever pain you can imagine, just multiply by 10. So I'm screaming. My wife comes in. Obviously, she sees the situation. I can't move. It's just amazingly awesome. We call EMS. They take me to the hospital. They repair my right femur because I had the potential of puncturing my femoral artery and I would have bled to death. So they fix the right femur. They don't fix my right arm. And I really refuse other treatment. And they send me to hospice to die. So this is the end of August of 2019. And I'm in hospice the first week of September 2019. There's a hurricane that is coming to Charleston. And it's only traveling 1 mile an hour, but it has wind speeds of 187 miles an hour. And it's so threatening that the hospice hospital was ordered to evacuate. They didn't know where to send me. My wife is an RN. She scrambled to get a hospital to bed in our house. So they send me by EMS to my house, and I am in a hospital bed, in hospice, in my home, in a hospital bed, dealing with a hurricane. We lose power for 12 hours. Hospital beds are electric, so that doesn't move. I can't move. There's no air conditioning. It's 90 degrees outside. I'm sweating. There's no TV. There's no phone. No light. It's awful. Absolutely awful. Plus, I'm catheterized. I have to use a bedpan. It's so demoralizing. And I must tell you, Dan, I'm ready to die. I had no problem with it. I thought this was the end of my life. So my wife is a phenomenal pillar of strength. And she basically said, look, you are not a victim. You're a survivor. You did so well until you had this accident. Let's get back on your protocols and let's see what we can do. And she convinced me of that. She got a physical therapist into the house. He helped me. I got rid of the catheter. I started using a walker. And I rejected or revoked hospice at that point, and then started to revive. And 1 month later in October, I went to my oncologist, and that's when he told me about these immunotherapy drugs that I got started on. And I continue with all my other protocols. So May 8th of 2020, he says to me, and things are stable, he says to me, let's see how the cancer cells are doing in your body. Let's do a new PET scan. So the first one was in my diagnosis of April 2018. The other one was June of 2019, showed lots of cancer throughout my body. So this one, May 8th, I do it that Friday morning. My oncologist calls me that Friday night. He says, make sure your wife is on speakerphone. And she and I are listening to him, and he's reading the radiology report. And basically it is summarized to say there are no visible active cancer cells throughout your entire body. Amazing.
That that is amazing.
So,
That is amazing.
but now, you know, the reality is I am not cancer-free. I am not in remission. I've never been in remission. I just have no visible cancer cells in my body. So what that meant is I'm going to continue with what I've been doing. There are
Mm-hmm.
some malignant proteins from the malignant antibodies that these malignant plasma cells were developing, and they're still floating in my body. I think my immune system, which I think is very strong, is going to, for the most part, gobble them up. And over the next several months, maybe I will be in remission, and maybe this incurable cancer I will have taken care of. I have no idea. And I'm not telling anybody what I suggest is going to cure any disease. But what I will tell you is that what I am doing is very naturally helping my body's immune system to function at peak performance so it can do what it's going to do.
Thank you for your personal share. I mean, that is,
And I feel great. I really
yeah,
feel great.
Al, that is amazing. Going from 3 to 6 months, going into hospice, hurricane, and your wife putting you back on the protocol. I will tell you that you have way too much to give and way too much to share with all of us. You are a survivor. You are our pillar of strength by
Thank you.
just hearing this story, and it just sitting here for me. I'm motivated. You have motivated for me to be a better functional medicine practitioner. You've whetted my appetite for learning that much more. I can't wait and for tonight when I'm done with patients to come home and start doing my studying, because every night I do a little bit of studying. Tonight's not going to be a little bit of studying. Tonight is going to be a lot of bit of studying, and that's going to continue on. So you're definitely our pillar of strength. You have so much to offer all of us, and thankfully you're here to impart and give us this education and this information. So thank you. I have to thank you from the bottom of my heart, and I can tell you I don't think there's a dry eye out there after hearing that story, because you know, I'm pulling myself back right now, and I'm the host, so I have to. So you know, I don't have that opportunity to do that. So
It's an interesting story, and one of the things that the reason I tell the story is that there are a lot of people that have some severe diagnoses that they're dealing with, and I just want to let people know that there is not just one way to treat disease and your problem. You need to be upfront with questions with your healthcare professionals. If your healthcare professional ignores you or poo-poos what you're asking, I would fire that healthcare professional and find a different one. There are good oncologists out there, even if they're conventional. They want to listen, they want to learn. The huge resource is called pubmed.gov. It's it's a free source. There's nobody sponsoring it other than NIH, and it is a receptacle, actually, of medical abstracts from all over the world relevant to any medical condition that you can think of. I'm sure there are hundreds of thousands and millions of abstracts that have been accumulated over the years that are there. So you just punch in a keyword and you'll see thousands of articles related to that. And that will give you an idea what other people are doing that is researched and published in medical journals that are peer reviewed, so that you can make some decisions. That is how I got to what I'm doing. The interesting thing I mentioned to you earlier is that dentists have this unique ability to diagnose, at least be aware of abnormalities in the mouth that reflect other things in the body, including cancer. Not always is it going to be evident, but if it is, the dentist can see that. But the dentist has this platform to educate his patients and her patients about nutrition and the biology of the system that is not just filling and drilling of teeth. And there is no certification program that educates patients like this until the International Academy of Biological Dentistry and Medicine came to me. They put me on the board as their periodontist, or the head chair of the periodontal division, and they wanted me to kind of contribute to a program, and I actually wrote a certification program that is basically 4 1.5-hour sessions with a whole lot of original material from me and my research. And dentists and dental hygienists and dental staff can literally go to iabdm.org and actually do that course at their own speed. And when they complete it, they will get 8 CEU credits, which obviously are important for the professional. And they also get a certification and a certificate, as well as a kind of a plaque that you can put on your wall as a professional. You know, professionals like to put plaques on their walls.
Yes, we do.
But the important thing is, it's called a Certified Biological Nutritional Dental Professional. And what it is, it's going to teach, like we just talked about, what are good diets? How do you recognize these things? What do you do to get the mouth healthy? How do you change the gut to become healthy? How do you support the immune system? That is what the course teaches. And it also talks about some of the toxic elements in the dental practice that need to be eliminated that are damaging our immune system. So it's an opportunity, I think, to get the word out, because what I have done for my body to make it healthier, anybody and everybody can do for their bodies to make them healthier and more resilient, and maybe more resistant to the chronic diseases today. You know, the CDC, the Centers for Disease Control and Prevention, have actually put the statistics on a yearly basis out there for the public, and the current statistics show that 60% of the U.S. population has a chronic disease, and that a little more than 60% are overweight or obese, and 70% of all deaths in the United States right now are a result of at least one chronic disease. Interestingly, primal societies that don't eat and live the way we live, that are remote in different areas of the world, do not have chronic disease. They don't have active gum disease or tooth decay. They don't have these problems. Our primal ancestors that have lived hundreds of thousands, or at least tens of thousands of years before us, have no signs of these chronic diseases prevalent like it's prevalent today. So we can do a lot by changing our diet and changing our lifestyle. And I think people need to be aware that they have the power to do it. It's not a pill. You know, better insurance is not going to do it for you. You need something that you need to do for yourself. You need to be proactive.
I think that's very important, because being proactive, and what I say to my patients and what I've said to my students this past week, you can't out-supplement a bad diet. Supplements are supplementary. The diet is always number one, in my opinion, and in your opinion, when it comes to nutrition. And it's good to take the supportive nutrients, but they are supportive. They're not in lieu of the diet, whether it's the carnivore diet or a Mediterranean diet.
Let me tell you, I'm sorry, I didn't mean to interrupt you.
Go right ahead.
I just want to make a comment that it's only I've become more aware of recently, which I think is very important. Even healthcare professionals like yourself probably know this, but it's not on the forefront of your thought process. But the gut epithelial barrier is the critical barrier. Absolutely needs to be healthy. So gut dysbiosis is important, but you have to have that barrier intact to prevent leaky gut. Well, here's the interesting thing. The gut epithelial barrier, one cell layer thick, which I said, replaces itself. It's the most regenerative tissue in the body every 5 to 7 days. Just think about that. You have a totally new gut lining every week. So if you ate junk, let's say you had a bagel with fried this, that, and a cola to drink, and it was terrible for your gut, but that's the end of your eating unhealthy, and you started eating healthy right away, and you eliminated all the other stressors on your gut, In 1 week, you would have a healthy gut barrier. In 1 week, all the potential damage that would be coming from the gut lumen is gone. Now, obviously, if you had a lot of leakage and it was for a long time, there are antibodies in your system that are creating problems. That's not going to go away. Okay. But you can have this epithelial barrier that's going to be healthy. That's why studies have shown if you change your diet and you have gut dysbiosis, change your diet, the mouth inflammation goes away within a month. Actually, it goes away probably sooner than that. But it's because you have a new gut barrier. Now you're not irritating that gut anymore, so there's no extra inflammation in the circulatory system, which is called metabolic endotoxemia. It's not streaming throughout your mouth. It's not streaming throughout every vessel in your body. Therefore, you prevent and maybe cure chronic disease. That's an important point, I think, to make.
It's an important
That's why
point
people need to be motivated.
Right. It's an important point for functional medicine practitioners. It's an important point for dentists to get this program and to learn and to be educated. So all the dentists that are listening today, please, this is so vital. This is so vital. Plus you get 8 CEU, which is always good, right? Because we're always looking for CEU. But the information and the application of that information is vital.
It's just a unique information put together in one place. I mean, you can find it, but you have to search out for it. You're just going to get it in one place. And one of the papers that I wrote that I make available for people if they want it is called Your Gut is Killing You. And it's actually from a chapter that I was writing for a medical textbook about gut dysbiosis and chronic disease. And it is very intense. I mean, it's 38 pages long. It's got over 260 or so peer-reviewed cited references. It gets a little into the weeds, but if you really want to get an idea of what I've been talking about in more depth, that's really what I've been doing for the last few years, you know, staying busy.
And I will tell you for all of those who want to read that, and if you can make that available, I'll get that link and I'll put it on the podcast if you want me to. And I could tell you that I read that. Al sent that to me last week, and I read it twice so far because it's really that important and that interesting. Now, we've been discussing for 1 hour and 20 minutes. We can go on forever, I think.
I know.
And what we're going to do, Dr. Al, is have you back on in the next 6 to 8 weeks. We'll probably talk immunity or gut health, and we'll stick to that because there is so much that you have to offer. As I've said, your wife said it to you. I'm going to say it to you. You are our pillar for this because this is just incredible. So what I would like to do is I want to have your protocol. If you could send me your protocol, send me the link for the International Academy of Biological Dentistry program. Send me the link for the for that article, for that 38-page article, because it's extremely important to whet everybody's appetite. Before we sign off, is there anything else you want to say?
No, I just appreciate the opportunity. I love talking about this. I feel great. I look great. I think I don't look like the cancer patients I see when I go to the cancer clinic. So I know I have a different look. And the most important thing is we really have control over our health. Don't succumb to somebody's diagnosis and prognosis and say life is over. It may be, but still, you can do so much. If nothing, you can do so much to improve the quality of life as you see other remaining time on this earth. And that's where I am. I don't worry about dying. I worry about decreasing the quality of my life. So I am doing everything I can. And again, I feel great. And I think most people can.
You look great. You look great. Continued success. Again, you are a pillar. You are a beacon of motivation. You're a beacon of inspiration, a beacon of knowledge. And you and I are becoming really good friends outside of our mutual interest in functional medicine, because we've been talking, as well as in functional medicine. It has been an honor and a privilege to have you on. We're going to have Dr. Al back on in 6 to 8 weeks. I can promise you that. And we want to talk more, and we want to hear what Dr. Al has to say, because it is truly, truly that honor and privilege. Thank you very much, Dr. Al, and continued success, and we'll have you back on.